When it comes to cardiovascular care on the organizational level, MedAxiom, an ACC company, understands the challenges your program is facing. Welcome to MedAxiom Heart Talk, the podcast where thought leaders come together for one ultimate goal: to continually transform and optimize cardiovascular care for all. MedAxiom Heart Talk starts now.
I'm Cheryl Toth, host of MedAxiom Heart Talk. Thanks for joining us this week for our COVID briefing, where we bring you answers and insights from the front lines. These special podcasts are one of the many resources MedAxiom is providing to members and the CV community to help programs deal with the pandemic. All of these resources can be found on our COVID-19 resource page at medaxiom.com/COVID-19. So joining us today from Crossett, Arkansas is Lori Walsh, MedAxiom's Executive Vice President, Membership and Operations. And from Grand Rapids, Michigan, we have Ginger Biesbrock, MedAxiom's Senior Vice President, Consulting. Thanks to you both for being here today.
Thank you for having us.
Thank you.
So let's start our Hot Topics update with you, Lori. Yesterday, you sent an email to MedAxiom members about CMS's second final interim rule that expanded access to COVID-19 testing and telehealth services. Tell us about that.
Yeah, so as our members know, these rule changes are coming out in waves, and the second final interim rule had some key measures for the members they've been very excited to hear about. One of them is the payment for telephone visits that will match similar office visits, so 99212 through 214, and these are actually retroactive to March 1st. So that's one exciting piece of it. Obviously, there's a little bit of additional funding for COVID testing. There's some clarification for ACOs, and also for our rural health clinic and our facility-based clinics. They are allowing the G code to be billed moving forward. So a lot of great news, but there was a ton of information, and our Revenue Cycle Solutions team here at MedAxiom is reviewing the FAQs, and we know some additional clarity will come out in the next couple days. So hopefully by Monday, Tuesday at the latest, we'll have some additional information for our members related to the second interim final COVID rule.
And how can folks expect that that'll be sent out? Will that be an email from you as well as putting it on the resources?
Yeah, so a couple of different ways, and you know, everybody learns differently. So we're going to do obviously a blast over the listserv with kind of the consolidated information. We will also update our virtual tool that Nicole Knight and her team put together, since we are seeing some changes in the actual codes and how you bill those and what you get paid. That tool will be updated. And then next week, we will either tag on to an existing webinar or maybe even do a webinar on its own to go through those changes again. I will say this has been so confusing for our members. We're hearing rule changes at the national level, but our MACs, those are the Medicare carriers at the regional and local level, they're not getting their rules updated fast enough. So a member will go out to their local MAC and look online, and the rules don't match what we're telling them and what CMS nationally is telling us. So a lot of confusion. So we will definitely send out a listserv, most likely do a podcast, as well as update the COVID resource page and the virtual tool.
Great. Well, I know that earlier this week, both of you participated in a webinar about how to handle patient care as programs start thinking about reemergence. And Ginger, I thought I'd ask you this one. Can you tell us some of the key points that you discussed when it comes specifically to patient care on that webinar?
Yeah, absolutely. Thank you, Cheryl. So yes, we are wanting to provide our members and organizations a framework around when they begin to look at reopening or reemerging from the pandemic. And beginning to think about increasing patient volumes and patient flow, whether that's in their clinic, in their imaging areas, or in their procedural areas. And so the goal is to create that environment where your patients are safe, your staff is safe, you can continue to provide high quality care, and we can be as efficient about it as possible. So that being said, things like social distancing and the 6-foot rule need to continue. What is that going to do to our patient flow? In addition to that, we have had the opportunity to provide care in much different venue over the last few weeks related to the virtual services. Mm-hmm. So how do we combine those and continue that work while beginning to manage those acute patients and subacute patients and those less stable chronic disease management patients that we need to get back into our clinics and monitor a little bit closer. And so what we've done is in each of those areas began to pull together not only the recommendations, say, from CDC or CMS and some of the other professional organizations, but offer some examples around workflows and protocol needs, policy development, things and the tools and the resources that you're going to need as you look to re-expand your services.
And as a reminder, this webinar, and I think probably the resources you're talking about, are all on the MedAxiom COVID-19 resource page, right? So that's medaxiom.com/COVID-19. A bunch of other webinars up there as well. Anything else? What are you hearing from members on the listserv? What else has been hot for the week?
Yeah. One other thing I want to add to that, Cheryl, which is hot. I think the hot piece of this is the question of when do we reopen? How do we reopen? How are we going to manage life moving forward? So questions on the listserv are things like, oh, I have this pent up long wait list for my imaging department and my nuclear and echo labs. Where do I start? And I have patients that were supposed to have procedures 4 to 6 weeks ago. Where do I start and how do I manage that patient volume effectively and safely? And so in addition to the webinar, which was really the kickoff to a much deeper set of resources, we're developing a playbook with the goal to make all the information and again, all these different recommendations from so many different organizations. We're synthesizing that for you. We're bringing it together in one place. It'll be easy for you to access. We're developing it with a series of chapters. So it's a playbook with chapters and sub-chapters in each of those areas that I described. So the goal will be, and this will be an ever-evolving document as we continue to learn more and kind of phase our reemergence over the next several weeks to months and maybe even year. And as we learn how to redesign the way we deliver care, our goal is to try to be out in front of that and get those resources and tools in the hands of our members so that we all don't individually have to try to recreate that wheel. So that's going to be available on Monday. We'll be launching that on Monday. So you'll get more information on that, but certainly plan to go to our website where you will see that link.
Terrific. What a great resource for everybody because, yes, everyone is out there trying to do this. So why not harness the power of everyone and what folks have shared on this podcast and all of the other things you've got in the Resource Center to make it easy. So not everyone has to reinvent the wheel in their own program. So everyone watch for that. That's Monday. Oh, and this just in, I just see an email from our producer that the playbook is available at medaxiom.com/COVID playbook. So there you go.
Great. Thank you, Cheryl.
Anything else you'd like to mention that you've been hearing this week, either of you, Lori or Ginger?
I would say that we're still, there's still a lot of confusion with our members around the CARES Act money that, we had an initial distribution between April 10th and 13th. It was about $30 billion, billion with the B, $30 billion that was distributed the first time around. And that money was automatically distributed into our members' checking accounts, which, everyone likes to wake up on a Friday and see money in their account. Then the second round of money has been signed into law. It was $20 billion. But for that money, if you're not tied to a health system where they are sending a cost report to CMS, you actually have to apply for that money, and you have to provide some financial information. Long story short, the rules, the Q&A, the terms and conditions have been very, very confusing for our members. So lots of activity on the listserv this week about you have to attest for the first money, you have to apply for the second money, what do you have to have, who's doing it, what strings are attached, is this free money, is it loan forgiveness? So we've got a lot of information out on the COVID Hub, again, related to the payments directly from the CARES Act for our providers. So if you still have questions about that, please feel free to reach out to us. If I don't have the answer, which I definitely don't have the answer to all of your questions, I can reach out to the ACC's advocacy department, and they can help me as well.
Great. And they'll find a lot of that on medaxiom.com/COVID-19. Yes?
Yes.
Okay, super. All right, let's close with the story of the week from each of you. It's always nice on a Friday to end up on an upbeat note. Ginger, you want to go first?
Sure. So as part of this, starting to think about reemergent, I would say once again, the power of knowledge and power of our community, and having different members come forward with some best practices and resources that they've developed, sharing stories on our webinars, sharing stories on the listservs of not only challenges, but solutions to those challenges. I think once again, it just shows the power of community and the power of our membership. And again, just so thrilled to be part of that.
Excellent. Lori, a hero innovation, great thing you saw or heard. What's your story?
Yeah, so I had a great conversation with a member this week that under an unfortunate circumstance, they've had some trouble with cash flow during the COVID crisis, and they had actually applied for the advance payment money that the program CMS had put out. Well, we heard late on Sunday night that they had shut that program down, and our member had applied and was expecting the money this week, really to keep their doors open. And had been told they were going to get the money. Then they get the email that the money's been cut off. So I immediately got in touch with our colleagues at the ACC advocacy department, and they helped us get an answer for our member. The member was grateful. The ACC was grateful that they could help contribute to easing the anxiety for our member. But again, it goes back to the power of our community and knowing that if somebody has a problem, MedAxiom may not have the solution, but we can find someone to help solve your problem. And so, I'm grateful to our members every single week that they have such faith in us that we can help them day in and day out, week in and week out, whether that's with advocacy or with the reemergence information that Ginger and the consulting team are putting together. Very exciting, and then warms my heart every week knowing that we're doing such good work for our members.
The power of community, the power of sharing information, resources, ideas, and all of this available through MedAxiom and the community that's been brought together. So I love that. Lori and Ginger, thanks for taking the time to join us for this week's COVID-19 weekly briefing on MedAxiom Heart Talk. It's always such a pleasure to have you here. Thank you.
Thank you, Cheryl.
Thank you.
And thanks everyone for tuning in to this week's COVID-19 briefing. We'll continue to bring you these special short episodes which address the most pressing COVID-19 issues facing CV programs and practices next week. And if you're enjoying these special programs as well as MedAxiom Heart Talk, please tell your colleagues and let them know they can subscribe on Apple, Google, or wherever they get their podcasts. If you'd like to give us feedback about the podcast directly, send an email to hearttalk@medaxiom.com.